frequency, urgency, and urge incontinence, plus stress urinary incontinence, no other medical comorbidities, bladder diary, 4 liters intake, urine 10 times a day and 2 times at night. Examination mild asymptomatic rectocele. She has already tried supervised pelvic floor exercises. She refuses any surgeries for stress urinary incontinence. What is the next step in management? So, the case of stress urinary incontinence with the failed pelvic floor exercises.
Any idea what can be your answer? Or you want to see the options?
See the options.
Yeah.
No. Not sure, ma'am. Bladder training?
No, dear. Read the question again. She is having some symptoms. She is having a bladder daily intake of 4 liters of water.
Okay.
What can you advise her for her? You have advised her the basic PFMT. Then also her symptoms are not relieving, and still she is having the same things. 4 liters water, 10 times urination, 2 times at night. What can be the reason for her?
Reduce fluid intake.
Excessive fluid intake. 4 liters water she is drinking. Is that recommended for the daily intake? And that also in... Okay? Clear?
Yeah.
Okay. Now, next. Yes. Sorry, dear. Sorry, yeah.
Stress urinary incontinence, but she does not wish any invasive intervention as she has to take care of her husband who is very sick. Completed 3 months of trial of supervised pelvic floor exercises with no improvement.
SUI proven? Proven means they have already diagnosed it. Already tried PFMT, but if PFMT fails, what is the next line of management for SUI, Raghavi?
I'm not sure, ma'am.
No, you have to be sure. SUI fails with PFMT. What will be the next step in her management?
Medications.
No, never. We never give medication. What is the next line?
Surgical
option.
Surgical. If she doesn't want surgical,
wait. Let Raghavi answer, my dear. We always do surgery, but she does not want surgery. So what is the next?
Medications, ma'am.
Medication. What medication?
Duloxetine.
Arey bhai, let her answer na. She knows the answer. Now Sumita will sit with you in exam and answer your questions.
Oh, sorry, ma'am.
Let her answer. Yeah.
Duloxetine.
Very nice. Okay. So, duloxetine is a choice only when the patient refuses the surgery. Otherwise, it is never a choice for SUI. Clear?
Okay, ma'am.
Go on.
Ma'am. If the option had
Yeah, Neha.
Ma'am, if the option had oxybutynin or tolterodine?
Those are not drugs recommended for SUI. Those are for OABs.
OAB.
SUI is only treated with the surgery. If not, then duloxetine as a medication. But anticholinergics are the drug for relaxing the bladder. Here the bladder is not a problem. Here the sphincter is a problem. So that is for OABs. Okay. Yes. Go on, dear. 25.
Following delivery of baby, she develops stress urinary incontinence. She wants more children in future. She is religiously following pelvic floor exercises since then, but no relief. The next management for SUI should be surgery only, ma'am.
Okay. She hasn't completed her family. She wants one more children in future. Then you will never offer her surgery.
Okay.
And duloxetine is only an option when the patient refuses surgery. Here she is not refusing surgery. You do not want to do surgery because she already has she wants one more issue which will again increase her chances of having SUI and failure of the procedure. So here even the duloxetine is never a second line management for SUI. It is only a line of management when the patient refuses surgery or any other intervention. Here the answer will be
not sure, ma'am.
intraurethral bulking agents. Okay. So any patient who do not want any intervention, then SUI can be treated with duloxetine. In the patients who are young and they are childbearing and they want future children, surgery you will not give them as an option. Then you can offer them a little simpler procedures. These are intraurethral bulking agents.
Okay,
Got the point?
yeah, ma'am. Thank you.
Okay, thank you. Yes, Preeti?
Sorry, ma'am, when do we use mirabegron?
Where we use?
Mirabegron.
Mirabegron is used for OAB patients in whom anticholinergics are either contraindicated or not effective.
Okay, thank you.
Okay, yeah. Yes, Preeti? Preeti, are you there? No? Okay. Who was the next to answer? Prabhati?
Yes,
And
ma'am.
after Prabhati, Pankhuri, and after Pankhuri, Nirmala. Okay, yeah.
There is retention of urine and patient is suffering from multiple sclerosis.
No, this one,
Can I-
26. SUI proved, stress incontinence, tried pelvic floor muscle
Tried
training with no benefit.
No benefits. We can give surgery to her.
Very good. What is the answer?
Surgical treatment can be the option, ma'am.
Yeah, what is the answer?
Can I see the option? Burge colpo
Yeah.
suspension.
Yes, very nice.
Full suspension.
Acute retention of urine in multiple sclerosis.
Next. It can be. Can I see the option, ma'am?
Mhm.
Self-catheterization.
Very good, very nice. Continuous individual self-catheterization can be done.
Yeah.
Why not mid-urethral sling in the first previous question where Bush
Because those uses a sling, those uses a mash. So as far as
Mash,
possible, they
yeah.
do not use. They want a surgery which is little safer from a long-term evidences. So Burch colpo suspension is little safer than mash. The
So
slings.
first priority always is the Bush,
Sling.
then is the mid-urethral sling.
Yeah, Burch colpo suspension, then it is a sling.
Ma'am, can you tell
Is it intermittent self-catheterization, ma'am, or what?
Yes, continuous intermittent self-catheterization. Yeah,
Can't hear you.
continuous intermittent self-catheterization.
ma'am?
Ma'am,
Can you
here the
Ma'am, in
surgery is
Burch
failed
colpo
now.
suspension,
Just a moment,
will we
guys.
do-
Just a moment. Let her complete 28. Then I will tell you the management of both SUI and OAB as a one page. Okay. Let's complete this question. Yes, dear.
Undergone mid-urethral sling procedure for stress urinary incontinence 10 years ago. Again complaining of the stress urinary incontinence. She has a strong pelvic muscle tone when assessed. MDT review done. Then
What
we
will be the
can
next step in her
offer
management?
We can give her botulinum toxin.
No. SUI, for SUI, you give botulinum toxin.
No, ma'am.
Which SUI is treated with botulinum toxin?
No, ma'am.
Failed surgery of SUI. Failed surgery of
Okay.
SUI. What are you going to do next? What will be the most appropriate management option? Management option can be a treatment or an investigation. So what is your
Urodynamic
most...
MDT.
Yes.
We will do the urodynamics and then we can go for
Okay, now understood the difference between the questions, how you will get in exam? Everybody,
Yes, ma'am. Yes,
little idea, more than little idea.
Yes.
Okay.
What's
Now-
the answer for 28, ma'am? Undergone mid-urethral urodynamic. Okay.
Urodynamic. Now, because she has a failed surgery, so already she has one failed surgery. So if you're planning to do, because SUI is only treated with surgery, because this patient would have already failed PFMT and her muscle tone is good. That means PFMT is not going to help her also. So the next best is to do a re-surgery, but before that you confirm the diagnosis by urodynamics.
So if in option there is MDT review first and it's
Then,
not in the
yeah.
question,
Either they
then
will give you
MDT first.
MDT review with urodynamics. Yeah, MDT review with urodynamics. Yeah. Okay, clear?
Okay, ma'am. Thank
Okay.
you.
Now, yeah, let's see the three differences between the management for the various type. SUI, pure SUI, when the patient complains of and she is clinically proven to have SUI, the treatment of choice is PFMT and lifestyle modification. That does not help her, then you can go for the surgery straight away even before doing a urodynamics. SUI associated with prolapse or SUI associated with the already done a surgery, always before a resurgery urodynamics need to be done. SUI along with the mixed urinary symptoms where the diagnosis is not clear, then before surgery urodynamics need to be done.
Ma'am, on your screen we can't see the slide.
Because I haven't written anything.
Okay.
I'm only speaking.
I thought it was stuck. Okay.
No. Okay, clear?
Yes, ma'am.
SUI treated with PFMT. PFMT fails, treat with surgery, Bush colpo suspension. Pure SUI. SUI with a mixed symptoms where the diagnosis is not clear. If you have done a conservative management and it's not helping, then before doing anything you need to do a urodynamics. SUI with prolapse, SUI previously treated with surgery, always do urodynamics before a surgery to be done. Clear?
Yes, ma'am.
Now, OAB. OAB is to be treated with the bladder training. How many weeks bladder training is there?
6 weeks.
Yeah. If that fails, then we offer them anticholinergic drugs. And the drug of choice is always oxybutynin. That is oral. Okay. If that is not helping, or if the patient is very elderly, where oxybutynin can have cognitive side effects, then the drug of choice is tolterodine.
Isn't it Mira background?
No. Okay. If anticholinergics are contraindicated, OTD, that is oxybutynin, tolterodine and derifenacin, if they are not available or are contraindicated, then miraburgan can be the option. Clear?
Yes, ma'am.
Mira
If the
is a M2 or a M3?
M3.
M2, okay.
M3, na? Bladder has M3 receptors.
All right, thank you.
If the drugs are not helping her, then before going to botulinum toxin, she will have an MDT review and urodynamics. After that, she can have botulinum toxin. Okay, clear?
Ma'am, I have a question. The patient with multiple sclerosis, can't you use electrical stimulation biofeedback on her?
Not as a first priority. Always the first priority is the self-catheterization.
Okay.
Okay.
Ma'am, OAB, first is bladder training, then anticholinergic drugs, and then it is botulinum toxin. Like this.
But before botulinum toxin, an MDT review with urodynamics is to be done.
Okay. Thank you.